Welcome back to Sepsis Voices with Dr. Ron. I'm your host, Dr. Ron Daniels, and I'm joined today by Cóilín Nunan from the Alliance to Save Our Antibiotics. Now, Cóilín is the Policy and Science Manager of the Alliance to Save Our Antibiotics, which is an alliance of 71 member organisations. It's huge, co-founded by Compassion in World Farming, the Soil Association and Sustain to really campaign against the overuse of antibiotics in livestock farming. And I remember some years ago now supporting them with a forward to one of their previous reports around E. coli and E. coli superbugs. Now, Cóilín has co-authored many reports on antibiotic resistance and antibiotic residues that highlight the human health impact of excessive antibiotic use in intensive livestock farming, which is something we don't often consider when we consume meat. The Alliance's work aims to encourage a move towards more responsible use of antibiotics in farming through better regulation, voluntary actions and improvements in production, whilst also improving animal health and welfare. And as a clinician, Cóilín, every day I see patients with sepsis, and already in my daily work, it's not unusual to find that some of our patients have resistance, which are resistant to antibiotics. And we can only imagine, but the reality is we're going to have to imagine it because it's coming, what is going to happen if antibiotics become ineffective for most patients. Now, Cóilín, after that lengthy introduction, is joining us today following the publication of a new report on the use of antibiotics in UK catering companies or by UK catering companies. Thank you so much for joining us, Cóilín.
Thank you very much for having me, Ron.
Well, let's dive straight in, shall we? What is the evidence that suggests that the consumption of antibiotics, if you like, antibiotics in our food chain, impacts on the resistance pattern among human bugs?
Yes, well, I mean, this has been a question that has been discussed literally for decades, and it has at times been quite a controversial issue. I mean, the first thing to state quite clearly is that the human use of antibiotics is considered generally to be the principal cause of antibiotic resistance in human infections. Nevertheless, it is now widely accepted by governments in the UK, across Europe and across the world, and by international organizations that the farm use of antibiotics does contribute to resistance in human infections. And for some infections, the evidence has always been very clear, despite some denials that have occurred. So, for instance, infections where most of these infections, such as in food poisoning infections, most of these infections are known to come from the food chain. It's very clear that when we feed antibiotics excessively to animals, it leads to these bugs becoming resistant in the animals. And then when they subsequently infect humans, the infection is resistant. So, for instance, for infections like Salmonella and Campylobacter, although it is true that in most cases we don't use antibiotics to treat these infections, in some cases we do, and it's extremely clear that a lot of this resistance comes from the use of the antibiotics in farm animals. But it's also the case that there is very unequivocal evidence that for infections like E. coli or even MRSA or Clostridium difficile, that farm use of antibiotics can and does contribute to the emergence of resistance in human infections. And how do we know this? Well, partly we know it when a particular antibiotic may be used exclusively in farm animals for a certain amount of time and not in humans. And yet we see emergence of resistance to that antibiotics in humans. So, for instance, this occurred with the emergence of resistance to the antibiotic Cóilín, which is now used because we have insufficient new antibiotics. It has become a last resort antibiotic used to treat certain life-threatening infections in humans. But the emergence of Cóilín resistance, and in particular what is known as transferable Cóilín resistance or mobile Cóilín resistance, this is a kind of resistance that can spread between different bacteria when bacteria pass genes or copies of genes in between each other. The emergence of this resistance was first found in China in 2015, at a time when China was only using colistin as a growth promoter in farm animals, and it was not using it at all. It wasn't licensed for use in humans, and yet when it was found not just in the animals, in the pigs and in chickens, but it was found in retail meat, and it was found in human E. coli infections, and not just E. coli, in Klebsiella as well, which is not often, considered to be something that is acquired from farm animals. Of course, it may not have been. It may just have been that the gene spread. So China reacted and decided to ban the use of colistin in farm animals for growth promotion, although unfortunately not for prophylaxis. This led to a 90% reduction in usage, and we have seen the colistin resistance in humans in China fall, even though colistin is now used in humans. Now, there are various other examples, including examples in the UK when antibiotics are exclusively used in farm animals, and this has led to resistance to these antibiotics emerging in humans. So we also know that there are certain strains of particularly MRSA. There's a livestock associated strain, and we can see that spreading from animals into humans, and the same for Clostridium difficile. There's a major strain as Clostridium difficile that is widely believed to be of pig origin.
So there is hope, really, from that Chinese example, that if we modify behavior, we can either slow the development of antibiotic resistance that's promoted by livestock use, or indeed reduce it and improve the situation. Now, this report today is about catering companies, isn't it? And it may seem an obvious question, but what sort of consumers does this affect? Who's going to be consuming the meat from the catering industry?
Well, pretty much everybody, or certainly a very large proportion of the population will have consumed or will consume regularly food from catering companies. So meals from catering companies go into the NHS, they go into care homes, they go into schools, they go into colleges, they go into universities. They also go into the workplace. Work events will often have a caterer supplying food. They are also suppliers of food to sort of private organizations where that people might visit, like museums or other sorts of organizations. So yes, there are many millions of meals served by caterers each year.
So this is all of us, isn't it? And you've mentioned particularly that catering companies are supplying our hospitals, our care homes, and then also our educational facilities and schools and even prisons. I mean, a lot of these environments will be looking after some very vulnerable people, and people who are particularly vulnerable to infection. Do you think we're doing enough here in the UK? Do you think the government's doing enough to protect these potentially vulnerable people?
Well, that's right. There are a lot of vulnerable people that are consuming this food, and what our report has found is that neither the catering companies nor the government is doing enough to ensure that the public procurement of food in many of these public organizations is sufficiently looking into the responsible use of farm antibiotics. So we examined 10 leading catering companies in the UK, and we found that only 5 of them had any sort of policy on antibiotic use. So half of them had no policy whatsoever. And for the 5 that did have a policy, we found that none of them prohibited the routine preventative use of antibiotics, and none of them gathered any data whatsoever on antibiotic use in their supply chain. So unfortunately, the policies are clearly not good enough. On top of that, although the government does set minimum standards for public procurement in what's called the government buying standards, at present, there are no antibiotic standards included in these standards for food procurement. And the concern there is that food, while regulation may be, considered superior in the UK to that in some countries, food can be imported into the UK and produced with extremely high levels of antibiotic use. And this is really why we need minimum standard for all food being produced for these public organizations, for the NHS and for schools.
It's really frightening, isn't it? And I think, just to clarify, that you're not, as an organization, against the appropriate use of antibiotics to treat individual sick animals. It's this sort of injudicious prophylactic use to prevent disease, but also as growth promoters, that we're really talking about here, isn't it?
Well, this is right. We're certainly not calling for an end to antibiotic use in farming, but we realise that most antibiotic use in farming is for group treatments. In the UK, this is still 75% of all farm antibiotic use, even though using them as growth promoters has actually been banned since 2006. Now, antibiotics can still legally be used for routine preventative use, although, to be fair, the industry in recent years have made significant strides in voluntarily reducing this use, and they have cut their use by 55%. The government is also considering banning routine preventative use, but so far they still haven't actually taken that step. They have consulted on it earlier this year, but they haven't given their response to the consultation. It should be pointed out that in the European Union, routine preventative use was finally banned in January of last year, and so the UK is now falling behind Europe in this respect. But even though farm antibiotic use has been cut by a lot, as I say, 75% is still for group treatments. Now, some of the leading countries in Europe, which have much lower levels of use, they actually use as little as maybe 3 or 4% for group treatments, and the vast majority is for individual treatments. And we really think that that is how to really demonstrate responsible use. Group treatments can occur sometimes responsibly in farming, but they really should be exceptional rather than the main way that antibiotics are used in farming. And so what we advocate for is improvements in animal husbandry, improvements in the conditions in which farm animals are kept, so that there is less disease to begin with, and less need for medicating entire herds or entire flocks of animals.
Yeah, and obviously we've talked about the catering industry and the agricultural sector. Do you think our food retailers are doing enough to ensure that their food chains are antibiotic free? Can they do more?
Well, we've actually published a series of reports on the antibiotic policies of retailers, and what we have found throughout these 3 reports is that they have gradually improved their policies. So by the time we published our 3rd report, we found that all 10 of the leading supermarkets in the UK now have antibiotic policies, and all of these policies ban routine preventative use for at least their UK own brand production. Of course, many supermarkets sell a lot more than just UK own brand production, and very often their policies don't apply to these animal foods. So certainly there has been progress, but yes, there is a lot more that needs to be done in order to really ensure that what is being sold in supermarkets is also produced with responsible antibiotic use. We know that there are foods that are imported or perhaps also in branded foods where there's less controls, and we know that some of this is produced with very high levels of antibiotic use. This has been linked in the UK to actual outbreaks of antibiotic resistant bacteria that are known to have caused deaths.
And just for context here, really, Cóilín, for our listeners, this is not a sort of antibiotic resistance is a spectre. It's not a sort of nebulous concept. I've already mentioned it's here today, but it's already claiming well over 1 million lives around the world every year, and it's estimated to claim, I mean, I think optimistically around 10 million more lives by the year 2050 if we don't act urgently. So this really it's an existential crisis that is in all our duties to address, isn't it?
That's absolutely right. I mean, it is something that so much of modern medicine really relies on, is access to powerful and effective antibiotics. And really a key problem here is that the era of antibiotic discovery is really behind us, it seems. Perhaps we will make breakthroughs, let's hope we do in the future. But for many infections, we've really discovered nothing new for over 4 decades. And this means that we really need to, deal with what we have. And the best method that we have for, tackling this huge crisis is by using the antibiotics we do have more responsibly. We do know that this can lead to reductions in antibiotic resistance. It can lead to slowing the rise of antibiotic resistance, and ultimately it saves lives. I mean, as you say, 1.27 million, it is estimated, people are dying annually directly because of antibiotic resistance. And in fact, it's estimated that up to 5 million deaths a year may be actually associated with antibiotic resistance. And that's already happening right now. So these are already huge numbers. And, a UK government commission report has forecast that unless we take effective action, the figures will increase to up to perhaps 10 million deaths a year by 2050.
Yeah, and I think some of us think that that's probably optimistic. It might be more than that. And again, for listeners, for the context, because these are big numbers, cancer claims around 8 million lives around the world each year, and tobacco consumption is responsible for around 5 million. These are huge quanta. So we've talked about what food producers can do and what governments can and should be doing, and what our retailers and catering companies can and should be doing. I suspect that some listening to this will be, frankly, quite surprised that they are consuming antibiotics in the meat they purchase from the supermarket, and quite horrified by that. And, to the same degree that you would be horrified if you found pesticides in the vegetables you were buying. So what role does consumer pressure have here? Do we need to work on public awareness, and what could be a good and responsible message to our public?
Yes, I mean, we certainly, as a campaign group, have tried very much to raise public awareness, and so and I think that to some extent we have succeeded. Not just us, but many other people working in this area have managed to somewhat increase public awareness of the issue. Clearly, there's a lot more that needs to be done there. However, it is also the case that awareness of itself is not going to resolve the problems. There need to be, solutions available that people understand and are motivated to use and are able to use. For instance, farmers themselves have been aware of this issue for many years. Vets have been aware of this issue for many years, but for many years we didn't see them taking action. It's only over the past 7 or 8 years that we've really started to see significant action taken by these groups. So the question of what needs to be done is and what can be done by the public generally, it also needs to be considered. I would also just say that on the question of how this resistance transfers through the food chain to people, that while it is true that antibiotic residues can and do occur in food, very often it is tends to be thought that it is more the transfer of resistant bacteria on the food to the consumer, either when they handle the meat or when they eat undercooked meat, that is believed to be the main cause of resistance transfer. So an important thing to do to ensure is, for instance, to not eat undercooked chicken, because you're far more likely then to acquire some sort of pathogenic bacteria. And of course, a further problem, even if you were, for instance, to reduce your consumption of meat, or even some people choose to stop consuming animal products, there is the question of transfer of resistance through the environment as well. A lot of the antibiotics are excreted in urine from the animals, and this ends up in slurry and in manure. It ends up in the land. It can get into the water supply, and it can end up ultimately on vegetables too. So, the environmental spread needs to be considered here too.
So it's not just about the public changing individual behaviours, for example, buying smaller quantities of high welfare meat. It's also has to be around the government pressure, the legislation, the environmental and cultural change, isn't it?
Yeah, I mean, we certainly do strongly advocate for a greater shift to less intensive production and higher welfare, and we believe that there is clear evidence that there is far less need for antibiotic use there, and lower levels of antibiotic resistance. So this can certainly help, and I think when we talk about the role that government plays, it's not just about the need to regulate antibiotic use better. It's also about making sure that less intensive production systems are properly supported, as they tend to be done a lot better in many other European countries. So the difficulty here also is that while consumers may wish to consume more higher welfare animal products, some of them may find it more expensive than it really needs to be. And again, that's also can be an issue with retailers choosing to put higher profit margins on some of these lines, higher than is needed, and ultimately leading to some of this food being considered for rich people only, whereas we believe that this kind of food should be available for everybody.
That's a really important point, isn't it, Cóilín? That it's one thing to say to someone like one of us, if you choose to consume meat, try and purchase it from a butcher's, try and understand the supply chain and understand the animal welfare and the use of antibiotics. It's another thing saying that to a low-income household, particularly low-income households with, fussy children in the house, which is something we're all familiar with. How can, and is there any practical advice for those lower income households to sustain good nutrition whilst avoiding intensively farmed meat?
Well, I think one issue to consider, of course, is about the quantities of meat and dairy that we consume. And in terms of good nutrition, it's very clear that many of us are eating far too much meat, and far more than is needed for good health or for good nutrition. And so a reduction in the amount of animal foods and increasing the amount of vegetables will tend to improve the likelihood of avoiding antibiotic resistance through the food chain. And it may mean that you may then also be able to eat more higher welfare foods if you are consuming less meat in total. But ultimately, we do need real government action, including, for instance, in public procurement, where higher welfare products should be being favoured by government, and thus enabling prices to be reduced. Now, there is some talk of this going to be happening, with the new government buying standards that are due. But this is a way of helping more people to access higher welfare foods as well.
That's a really interesting point. And we only have to look back a few decades, don't we, that a typical non-extremely wealthy family would see meat as a luxury and a privilege to consume on a Sunday, for example, with less consumption during the week. And, perhaps that is a strong message that can become palatable to the public over time. So obviously you've issued your report today, and, we've had sight of the headlines, and it's really important. And of course, you'll have reached out to the media. Do you think that the press and the media could play a greater role in talking about AMR and talking about what individual behaviour changes our public can make to address it?
Yeah, I mean, I think we generally do tend to get reasonably good coverage for our campaign, and so a lot of the good that has come from our campaign has come because we have been able to get coverage in both broadsheets as well as even sometimes some of the tabloids or even highly influential newspapers like the Daily Mail or on radio and television. So there is certainly coverage of this. Sometimes perhaps the media are sort of too keen to publish stories that are excessively sort of depressing and scary and insufficiently interested in examining how we can really improve this in a sort of a in terms of policies and in terms of what possible solutions might be available. So there is sometimes a slight difficulty there in having a completely sort of grown-up debate about where we need to go with farming, where we need to go with food, how antibiotics should be used. There's maybe sometimes a bit more interest in sort of scary superbugs being found on food, which of course is an important part of the whole story, but certainly more discussion about the solutions and what positive solutions there are would certainly be something that we would hope to be able to see a bit more of.
And we've seen with campaigns, particularly around the environment, thinking of as an example, the sort of plastics in the ocean, the engagement of school children, the engagement of our next generation. How important do you think it is that we try to do that? And do you think that our next generations have a handle on the concept of antimicrobial resistance, or do you think we need to start to work really hard with that demographic?
Yeah, that's a very good question, and probably we do need to do a lot more because I suppose as campaigners we haven't really done a whole lot in that area. We've certainly worked with university students, including undergraduates, and but in terms of what goes on in our schools and how farming occurs in practice and how antibiotics are used in livestock, I don't think that most people really still understand that story, either children or adults. Certainly from my own conversations day to day with people, there is certainly more understanding of this issue than there was 10 years ago, but there's still a lot of surprise when I tell people about how antibiotics are used in farming or about the conditions in which animals are kept. It's quite surprising sometimes.
I can imagine. And I think we as health professionals are sometimes guilty of not talking about antimicrobial resistance sufficiently. I think we often don't tell our patients, even if we believe they have been affected by antimicrobial resistance, that that's the case. And I know as a charity, when we're approached by journalists who are looking for someone who's been harmed by antimicrobial resistance, we always have to find a sort of surrogate person, someone who tells us that they were getting worse and they only started to get better when the doctor changed their antibiotic. Do you think we as health professionals need to be more honest about antimicrobial resistance to our patients?
Perhaps. I mean, obviously, I'm not an expert on what goes on, in healthcare, and I'm sure, that there are good reasons why certain things don't happen. But it does seem to me that that sometimes antibiotics are prescribed repeatedly, sometimes for patients without sufficient studying being done as to what it actually is causing the infection and what the resistance might be. So there does seem to me, from my own personal experience, to sometimes be an excessive reliance on antibiotics. I think also, just more generally, there is insufficient surveillance, and this certainly applies for livestock as well. We do have surveillance for antibiotic resistance, but we don't have nearly enough of it. And sometimes it seems that we don't have enough of it because we don't really want to know. And so we don't do certain studies because we're a bit afraid about what we might find. So this obviously then complicates our whole understanding or lack of understanding of what's actually going on, and sometimes makes debates more controversial than they need to be, because quite simply the data isn't there.
Yeah, I think that's absolutely right. So we've coming back to sort of the public talking about this and becoming more aware of it. From a sepsis perspective, it's often been quite easy for us to find celebrity ambassadors and influencers to talk about sepsis because, of course, it's a very prevalent problem and it will, from time to time, affect a higher profile person. Do you think you have a role for antimicrobial resistant celebrity ambassadors and support? Is this something you're working on, or is it difficult to identify such people?
Well, we have had some celebrity support. So, for instance, the TV doctor, Dr. Chris Van Tulliken, he gave support to our campaign when we launched a petition aimed at supermarkets, asking them to improve their antibiotic policies. He gave us support. We've had quite a few years ago now, we had support from the actress Leslie Ash as well, when we revealed the emergence of MRSA in livestock, and the fact that it could spread to humans. So it is certainly something that we have done, and it is true that in the animal sector there are other organizations doing sometimes similar or slightly overlapping work with ours, or work focused on animal health and welfare, where there are numerous celebrities that are quite willing to endorse what is being campaigned for. So I do think that it can certainly help. I suppose one consideration, which I suppose we've touched on already, is the fact that some people obviously are going to be wealthier and more able to afford more expensive meat or higher welfare produce, and so if and celebrities would tend to be amongst those people, and so we need to be careful that it's not seen as just some rich people telling other people to spend more money on more expensive food, and that really this is food that should be available for everybody, and this is an issue that affects everybody.
I think that, Cóilín, that is a critically important point to finish on, and it's really something for the government as well as food producers and retailers to seriously consider. That is all we've got time for today, sadly. But Cóilín, thank you so much for your time, and thanks to our listeners. If you'd like more information about the UK Sepsis Trust's stance on antimicrobial use, then head to our website at sepsistrust.org, and you can find out more about the work of the Alliance to Save Our Antibiotics at saveourantibiotics.org. Cóilín, thank you very much.
Thank you.